Everybody, good afternoon and welcome once again to our weekly media briefing, COVID-19 with Montgomery County Executive Marc Elrich, Health Officer Dr. Travis Gales, and Dr. Earl Stoddard, who is the Director of the Office of Emergency Management and Homeland Security. Of course, they will give us our weekly public health update, but today we also have additional guests joining us. We have Stu Solomon from Connected DMV. He is President and CEO. He will be presenting their approach of the Global Pandemic Prevention Center. In addition to that, we have Jerome Fletcher. Welcome. He is Assistant CAO. And Ben Wu, who is the President and CEO of the Montgomery County Economic Development Corporation. Ben and Jerome will be available for questions and answers toward the end of this presentation. And once again, I'm Lorna Virgili, Hispanic Public Information Officer. And with that, I toss it to you, Mr. County Executive.
So thank you very much, and thank everybody for joining us today for our weekly COVID briefing. Today, the county has a positivity rate of 2.08%, and our case rate is 6.13 per 100,000. Among the large jurisdictions in the country, we are the 12th lowest, and we are the lowest east of the Mississippi River still. That I, fully attribute to two things. One is following the medical advice of our health department and the guidance they've given us to ensure that we have as healthy and safe an environment as we can work in. And I also, give credit to the residents of Montgomery County because a lot of people have rules, and in other jurisdictions, the rules don't necessarily get followed. We weren't out enforcing these rules with the police, anything else. We relied on people's compliance with what we asked people to do. And the residents of this county have done a remarkable job of doing the things to keep people safe. And I give a lot of credit for our success to the behavior of the residents in this county. We have fully vaccinated 38% of our total population, and 54% of our population has received at least one dose. And these numbers are from the state numbers on vaccinations. We will be moving to the CDC vaccination numbers from Montgomery County, where they have us now at 42%. And we're currently integrating their numbers into the numbers that we use. And the reason we're doing this is that the CDC numbers catch all Montgomery County residents wherever they get vaccinated. So if you got vaccinated on your job or with your job in DC or Virginia or any other place, we don't capture that data in the state system. And so the CDC gives us a more complete picture in terms of total numbers of people vaccinated. The state system gives us a better number in terms of the breakdown of the population that's vaccinated. So we'll be combining the CDC numbers along with the numbers that we have, so that we have a more accurate and more complete picture. So we'll see, we see a jump of a few percent. Get excited, but not all that excited. That's not letting anything change. It's just we're using a more accurate data set. We're still in phase 1 of reopening. Once we hit 60% of the residents with at least one dose, then we'll be moving to phase 2. And we also started direct registration for vaccinations and walk-ups this week, and that'll be expanded. So that means you won't have to pre-register. You'll just be able to go online and schedule vaccinations. It's important to note that the percent of people being vaccinated on total, only 83% of the population has been eligible. For every age group that is open to vaccines, that increases our eligible population by 1 or 2%. However, I'm concerned that we saw a 19% reduction in vaccine uptake across the county for all residents for the previous week, and a 25% reduction from the average of the previous 5 weeks. This is not a lack of vaccine problem. This is a lack of people coming in to get vaccinated, and we really need people to finish the job. We are so close, and I know people want to reopen, and so that portion of the population that would get us to 60% and then to 70%, it is key to get these folks vaccinated. So if you're not vaccinated, if you know somebody who's not vaccinated, if you now have a child who's 16 and older, please come in and get them vaccinated. It's critical, and it's what we need to do to fully reopen. And we think we're on a path to do that. We just need to get everybody as much vaccinated as possible. It is likely that I think it's the Pfizer vaccine will be approved down to 12-year-olds, and that they are in a longer-term study that could see down to 2-year-olds, or down to 2 or 3-year-olds by the fall. That's out there a little bit, but in the immediate reach, we think the 12-year-olds might well be added pretty soon. This is a great chance for us to complete the vaccinations and really move to a place where we're safe. I know everybody would like to be reopened more. I would like to be reopened more. So I can see how we get there. I think hopefully you can see how we get there. Right now, it's not waiting for promised vaccines that don't arrive. Now it's taking the vaccines that have arrived. So please come in and get your shots. We're going to open more county clinics closer to where people live, and we're going to shift hours, days and evenings, to make it easier for more people to come in. And we want to make sure that the time of day is not an impediment to getting vaccinated. Additionally, we're aggressively marketing, advertising, and engaging our targeted zip codes and communities where vaccination rates are lagging. And over the next several weeks, you'll notice a new marketing campaign to engage our younger residents. We've tied our reopening to vaccination rates, which was the smartest way to incentivize our residents to get vaccinated. Now there's an absolutely clear link between the percentage of you that are vaccinated and the number of things that will be opened up. So again, we need to convince our friends and family and neighbors to get the vaccine. On other notes, this is Older Americans Month, and today I did a food delivery out at Holiday Park Senior Center and helped with the delivery of food there. Since the pandemic started, we've delivered more than 183,000 meals to the homes of seniors unable to shop or cook their own meals throughout the pandemic. Our partner organization has delivered over 580,000 meals to county seniors. The pandemic's forced us to improve our delivery and focus food access programs, and this work is going to continue beyond the pandemic. We had a meeting the other day to discuss how we're going to more fully support and have a more coordinated food relief program in the county going forward. We know people needed food, and we've been providing food for people before there was a COVID virus. We're going to need to be doing this after the COVID virus. In addition, there's going to be a lag in employment that'll increase the need for food between the end of the virus is a major problem and when people go fully back to work. And so we're trying to take what we've learned from this to make sure we can get food out. May is Older Americans Month. I guess I'm now an older American instead of a senior. All works for me. Our older adults have been the most impacted by the COVID pandemic. It's good news that about 85% of our 65 and older population have received one shot, and 73.2% are fully vaccinated. So please keep coming in. It's really critical. At the beginning of this vaccination rollout, we prioritized this population, and it's paid off. However, many older adults are still isolated from their families and friends, and the loss of the social connection has been really tough on their mental health. Opening will help go a long way to dealing with those isolation problems. And there are many who are food insecure, and they're choosing between their food and the medicine, which is why we're making sure that we have a robust food delivery system so people don't have to make choices like that. We have to be sure that we're also getting our older seniors other resources that we provide beyond meals, such as rent relief and mortgage assistance and mental health assistance. I'm very proud of the Department of Recreation and HHS for their adaptation to the pandemic and commitment to serve our older population. Many employees have had to adapt to new positions and responsibilities, and these departments have readapted their programming and their outreach and their communications. Soon we're going to begin reopening our senior centers, and we'll be bringing back more in-person activities and services. I want to take a moment to acknowledge that yesterday was Teacher Appreciation Day. Over this last year, we've asked our teachers to educate in ways and methods that few had experienced, and every teacher had to make immediately effective. I have enormous sympathy for the jobs the teachers did. I was an elementary school teacher. I can only imagine, actually, I can pretty much visualize how difficult it was to teach elementary school virtually, and many other challenges that we have as they come back to school and teachers are teaching to a split audience of students in the classroom and students at home. So they continue to innovate, they continue to address the needs of the students that they are responsible for. And I just want to thank them for their creativity and patience and perseverance. Hopefully next year will be a much different and much better year than this year. May is also Asian American Pacific Islander Heritage Month. I went to the celebration on Saturday in Cabin John Park to kick off that month with some members of the council and the state delegation and community representatives. We also had the AAPI students who were very thoughtful and elegant in expressing their ideas about community and how they've experienced this very difficult year. The last thing I want to talk about, and Stuart Solomon will follow me, is talking about, we'll get to Stuart, is the Global Pandemic Prevention Center. Yesterday, the council passed $500,000 toward the Global Pandemic Prevention Center planning stage. I thank the County Council for this action. I went to the first general meeting back in December. Today, we have Stuart Solomon here from Connected DMV, Jerome Fletcher, who's the Assistant Chief Administrative Officer for Economic Development, and Ben Wu, who's the CEO and President of the Economic Development Corporation, to go into further detail about this project if questions arise. This center is critically important, not just for Montgomery County, but for our entire nation and the world. I think, it's a fair assessment of what happened with COVID, that the entire world was caught flat on its feet. That efforts to prepare for a pandemic, which had been ongoing and not at the scale probably that they needed to be, but even those efforts were unnecessarily brought to a halt. We clearly had not done the research and done the work that would have left us better prepared. And I think the message that everybody's gotten from this is likely not the last pandemic we're going to see. Viruses continue to mutate. This is no reason to believe this is going to end. We already see within COVID multiple strains of COVID that have different levels of effectiveness when it comes to the vaccine, and that have different effects, some being more severe than others. So we need to be better prepared, not just for COVID, but for the world that we envision is going to be a little bit different and a little bit more dangerous when it comes to pandemics. And we need to make sure we get this work done. This is not a Montgomery County thing or a DC thing. It's going to be a global thing. We've worked with partners from across the region, from local and state governments, from the private sector, and from academia, because I think everybody realizes we have to get it right this time. We cannot afford to be unprepared, and hopefully this will lead to the president supporting the creation of this center. I'm going to let Stuart talk more about that. It fits well, though, with our broader perspective in recognizing that Montgomery County is one of the leaders, if not the leader, in vaccines, and it is certainly one of the leaders in life sciences. And we have a robust industry here, and we believe that we can grow it further. That's the reason behind our working with WMATA for the joint development of the White Flint WMATA site, because we want to make sure that we become the home of this kind of research between NIH and NIST and all the other government assets we have here, between our academic partners in the state of Maryland, and between the amazing companies that inhabit our life sciences center. We believe that we are ideally positioned to take advantage of this. So with that, I will turn this over to Dr. Gales and Dr. Stoddard for their add-on, and then we'll return to the pandemic, I believe. Unless the host has another plan.
Good afternoon. Happy Wednesday. Always a pleasure to be with you all. I don't have a ton of updates beyond what the county executive has mentioned to leave room for our guests as well as any other questions you may have. I do want to highlight a couple of points. As the county executive referenced, our community transmission levels continue to look good and are trending downward as we continue to see an uptick, albeit a slower uptick than we saw at earlier stages, but still an uptick nonetheless in terms of the percentage of our residents who are getting vaccinated. I want to double down and emphasize that it is important for you to get vaccinated to protect yourself and to protect those in your network, including your family members, as well as your coworkers and any other individuals that you may come into contact with. The communications team is working on some new strategies to increase outreach to some of those younger age groups where we have seen slower uptake of the vaccine now that they are eligible based upon their age criteria. So we are continuing to encourage those folks, particularly you early to mid-20s to mid to late 30s, to get vaccinated, as your numbers in terms of participation are lagging behind others. Now, with respect to the age issue, the FDA will be hopefully sometime within the next week hearing the request from Pfizer to allow for their vaccine to be used in ages down to as low as 12 years of age. And we are preparing in the background to develop strategies to be able to make sure that all of our residents who fit that age group are eligible and able to get their vaccines. I want to emphasize that, yes, it is important for those who are under the age of 18 to have parental consent to get the vaccines, but parents don't have to be present for the kids to get the vaccine. They just have to make sure that the consent form is signed for records. So we will continue to work and announce any particular special opportunities that are available to make the vaccine more available to those younger populations. We will be working with our colleagues in the non-public and public schools to develop and flesh out further strategies. In addition, the Maryland Board of Physicians sent a letter on yesterday to all providers, particularly those in pediatric specialties, to make sure that they are aware of this potential change and have registered in Immunet so that they too also will be able to have vaccines available for the pediatric and adolescent population. We did see an increase in our allotment of doses to the health department this week, of an increase of 2,000 doses from last week. We continue to use a combination of Pfizer, Moderna, and Johnson & Johnson doses. We've used the Johnson & Johnson doses that we had left over when there was a pause several weeks ago to support our homebound efforts. Our team reached out over the last week, both through phone and email, to those individuals who had pre-registered in our system and indicated that they were homebound. We will be utilizing those Johnson & Johnson doses to get out into the community to make sure that those folks are covered for extra protection to keep them safe. The last thing I will say, as the county executive referenced, and Dr. Stoddard may opine and comment on further, is that we will be switching and shifting our scheduling to a direct scheduling or a walk-up type scheduling, as we have gone through and exhausted the roles of folks who have pre-registered both locally as well as those names that the state has provided to us. So I will stop there. Happy to answer any questions that you all may have. Happy Teachers Appreciation Day and week, and also happy Nurses Appreciation Week as well. And thank you to all of the nurses who've been a part of my career and a part of all of our lives, making it better from a medical and clinical standpoint. Thank you.
Thank you, Dr. Gales. Thank you, Mr. County Executive. Dr. Stoddard, your turn for opening remarks.
Thank you, and welcome back, everyone. Thanks for returning. Just a few comments to add on to some of the things that the county executive and Dr. Gales alluded to. So we are doing walk-ups already at the Germantown mass vaccination site all throughout this week from 10 a.m. to 2:30 for the rest of the week. We have so literally as we speak, you can walk up now and get a vaccine. There are no lines. We're using Pfizer throughout the rest of this week, and we'll also have Moderna available early next week. I think it's important to note, if you looked at our county dashboard, you would note this as well. County residents across the entire system only received 701 first dose vaccinations yesterday. That compares to 3,982 a week ago last Tuesday. So we do have a lot of available capacity for people to come in not just at the county sites or at the mass vaccination sites, but at pharmacies and other opportunities across the board. And so find a location that's convenient for you, and the odds are there's going to be an appointment or a walk-up opportunity available to you. We need people to continue to come in and get vaccinated, not just to achieve our reopening numbers, but frankly to protect our children and others who cannot be vaccinated yet, and continue forward with the reopening and just getting back to what we all want to be doing. The last thing I will note is that we did update, the team did update the pool guidance earlier this week. So if you note on our county website, we did both attune it to the Board of Health Regulation and reopening metrics for vaccination, but also did add some immediate, relieve some immediate restrictions around lane usage and things like that. We also have a timeline for wading pools and other baby pools and things like that reopening, which is later this month. So we encourage those who are in the pool space to look at those updated guidance, and gives you a roadmap for how things will be reopened in alignment with the vaccination rates. That's all I have today. Thank you.
Thank you, Dr. Stoddard. And now we're going to have a short presentation from Stu Solomon, President and CEO of Connected DMV. Stu.
Thank you, and thanks for having me join you here today. Let me express my thanks to County Executive Elrich. As we talk about this initiative, he was one of the first to reach out when this became public and really started a collaboration together between Connected DMV and the broader regional team and Montgomery County. So County Exec, very much appreciate that and the local support that you're helping to drive for this. Let me also say, before getting into background, that I thank you to the council. The Montgomery Council has been incredibly supportive, and I think that type of collaboration really frames the type of work that we think is necessary to drive these complex strategic initiatives that make our region, the nation, and the world better. We had a bunch of great help, folks like Jerome Fletcher on this call, Dale Tibbetts, Ben Moo over at Montgomery County EDC were very instrumental as Montgomery County, the team together, really organized to help us advance this initiative well. So thank you for your financial support, and thank you even more for the engagement and the working together. That's critical to making this initiative go exceedingly well. And to the county executive's comments, let me also say broader, on a more regional basis, the state of Maryland has been incredibly instrumental. Secretary Schultz over at Maryland Department of Commerce, Chancellor Perman at University of Maryland System, Marty Rosendale at the Maryland Tech Council, Rich Bindus with the life sciences industry, all are pitching in to make this work and to make this work well. And so with that, let me give a little bit of context for folks to understand how this came to be. And for starters, there is a Connected DMV Strategic Renewal Task Force that was launched over a year ago and is still in operation. It represents 51 leaders from across our region, Greater Washington, leaders from government, industry, academia, and the community alike. And it also has at its core 17 key regional organizations like the Council of Governments, the Consortium of Universities, Federal City Council, the Board of Trade, WMATA, and other such organizations. So this group has been meeting for over a year. Last August, this group came together at their monthly convening, and we had asked Dr. James Crow to present about monoclonal antibodies and a potential gap in the prevention chain that needed to be filled. And he shared that presentation with the regional task force. The regional task force overwhelmingly voted to support this, and that was the original genesis of this Pandemic Prevention and Biodefense Center initiative. So it was a regional collective effort coming together, and Montgomery County was front and center and helping drive and organize and steer this. So that was the original genesis. We put a team together in the fall, and that team within Connected DMV then began to put the strategy plan and strategy phase together for this pandemic center. And that formally launched in January. In January, we launched the steering committee as well. County executive serves on that steering committee along with other key regional leaders, but it also includes top scientists from around the world, from government, from academia, from industry, coming together to try to solve this problem of future pandemics. So Greater Washington is obviously the right place to lead, and Montgomery County sits at the heart of that. And so we're so pleased to have this arrangement and to be able to look forward to establishing this center in Montgomery County. As part of that body of work, we'll be soon initiating the site selection requirements and the overall requirements for the facility itself. That work is still in front of us, and your funding certainly helps us to do that body of work. A little more context. About 3 weeks ago on 60 Minutes, Dr. Matt Hepburn was featured, as was Dr. James Crow and Dr. Kayvon Majerad. So the three of them were featured around pandemic prevention and specifically around monoclonal antibodies. And in that segment, we heard Dr. Hepburn refer to the moonshot for pandemic prevention. And that reference is exactly this project that we're doing together in Montgomery County. This is the moonshot for how we can get in front of and prevent future pandemics from happening. And so if you've not seen that segment, you may want to look at that. And as a result of that, or as an ongoing part of that, again, we've assembled the best leaders from around the world to address this challenge. Dr. Crow was the founder and visionary of AHEAD 100. And again, he spoke at the task force last August. And AHEAD 100 stands for the development of human monoclonal antibodies for the top 100 pathogens in the world. Now, as you know, there are countless pathogens out there, many, 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 and the scientific community tracks these and studies these and comes up with solutions for them. We've got the scientific community together agreeing on what that top 100 list is right now, and that's happening through the steering committee. And so that top 100 that this initiative would address, AHEAD 100 within the Pandemic Prevention Center, will create what we call a critical medical countermeasure that can be deployed when an outbreak occurs. So when an outbreak occurs, basically what happens is the scientific and medical community come together to get solutions in place to help deal with that outbreak. But those first, call it 30 days, 100 days, 12 months, whatever it might be, before vaccines are effective and available, there's a gap. And that gap can be filled if we have monoclonal antibodies on standby. So we're working to develop a stockpile of those antibodies so that when an outbreak occurs, we can immediately protect healthcare workers, we can immediately protect the surrounding community from the outbreak, and even therapeutically, antibodies have the ability to cure someone that's been affected. So we need to create that critical national stockpile or global stockpile of antibodies so that we can fill that gap in the chain so that a solution can be available on day one when an outbreak occurs. When we do that, that will stop the outbreak cold in its tracks. That is the premise and the foundation on which we're working, and prevent a pandemic from ever occurring. So if we think about the ability, we think about the 3+ million lives already lost, and we think about the ability to prevent the tens of trillions of dollars in economic harm, this $2.5 billion project, we believe is a very responsible and extremely economic way to address that risk. So that's the Pandemic Center, very briefly. It's also the launch initiative, AHEAD 100, with the monoclonal antibodies. And that's the moonshot. That's why we're together. That's why Montgomery County sits at the heart of this with the best assets, capabilities, talent in the world, leveraged with our broader global network. This steering committee, if I can say, part of the effort includes defining the requirements for the site. And I know that's one important factor for Montgomery County, in addition to how Montgomery County is leading on a global scale for such an important health initiative. So that site selection process will begin. We don't have a site selected yet. We'll go through the diligent process of looking within Montgomery County for the appropriate place. And we'll talk more about that in the days ahead. We also think, as you look at the Biden administration's announcements, their support for these medical countermeasures is well articulated. They're wholly supportive of solutions like this. So we're in the process of working with the large philanthropic community as well as the federal government to determine the right balance between the federal government and governments, and as well as the large philanthropic community in supporting an initiative such as this. We believe Congress will be wholly supportive especially in light of what we've all just experienced with COVID-19. So with that, I think that's some initial context. We're happy to take questions. And again, let me just express my thanks to not just to the Montgomery County leadership represented here, but also to those of you from the media in the responsible way and productive way that you're helping bring this global capability to light.
Thank you, Mr. Solomon, for those opening remarks. And let's get started with the Q&A portion of this presentation. You're first, Tom Fitzgerald, Fox 5 DC. Questions for the county executive and also for the doctors. Tom?
Good afternoon, everybody. Thanks for doing the call. I'll get right to it and give you the three right off the top, and you can take them in order. County executive, you had a lot of good news at the top there, the positivity rate, where we're moving in terms of vaccinations. The question is this: the governor says he wants the state open by Memorial Day. Is Montgomery County prepared to open the state by Memorial Day? For Dr. Stoddard, is there a requirement for kids attending outdoor summer camps to wear masks, and if so, why? And Dr. Gales, curious about the vaccinations right now. You had mentioned Johnson & Johnson. How are you doing with people taking Johnson & Johnson? Are you seeing any refusals in light of the 10-day pause that was put into effect? And I'll be quiet at that point.
Okay, who's taking these questions?
Okay, I'll start with the first one. This is all numbers driven. So we'll see where we are on Memorial Day. I mean, if the rest of the state is having the same difficulty getting people vaccinated, and I believe everybody's seeing the same fall off, it's a little bit difficult to see from what is today's date, May 5th, that, we're looking to cross the 60% mark. We had thought that 70% would be the point where things would be generally more open, and along with getting half the population at least fully vaccinated. I wish I could say I was sure we would achieve all those things in that time frame, but it's not certain we will. And I'll just say, just fundamentally, it bothers me when people set dates that you cannot relate to the science of the thing you're trying to deal with. It'd be one thing if you knew that you had these many people waiting for vaccines who are ready to take them, and if we just simply gave them to them, we'd achieve some goal. But the governor doesn't know how many people are ready and willing to take the vaccines. He doesn't know what the supply is going to be, and that's not his fault. We'd wait for others to tell us what the supply is. So I wish people would just be patient. I mean, I feel like at this point, after doing this for 15 months, it makes little difference whether it's, May 30th or July 4th. The main thing is to get this over and done with and make sure that when we go back, everybody can be healthy and safe. So we'll look at the data like we always have. At least if the health department changes their perspective on data, I'm sure I'll be the first to know.
I'll start with the outdoor summer camp for children issue. I'm sure Dr. Gales may also have some feedback on it as well. So, I mean, according to the Board of Health Regulation, we are following the CDC outdoor masking guidelines. And so I believe what the CDC outdoor masking guidelines would say is obviously children cannot be vaccinated, certainly under the age of 16 cannot be vaccinated at this point. So obviously those are unvaccinated people who are outdoors. If there are a large number of them, the CDC guidance would say you should be wearing a mask. I mean, that's pretty clear, and that's what the Board of Health Regulation would say. And so now it may change at some point over the summer as children become eligible for vaccination, and they can be vaccinated, and maybe older children, there may be some different, according to the CDC rules, if the CDC rules stay the same and they're vaccinated at that point and they're small groups, then I think they can go unmasked, but it really depends on whether they're vaccinated or not and how large the group is according to the CDC. Dr. Gales, I don't know if you had anything to.
And the trifecta, I actually don't have anything further to add on that question. I think Dr. Stoddard answered it pretty pretty clearly. In terms of the Johnson & Johnson doses, so I think universally we've all been concerned that there may be some fatigue or anxiety around those particular doses. I do know that on Monday we had, I think, 1,100 some spots available, and we vaccinated just over 400 folks with that shot available. So we're going to continue, in addition to the efforts that I referenced in terms of having that focused outreach to those key communities that still have yet to be vaccinated now that they're eligible, is to make sure that we continue to hammer home the message that the vaccine is safe, it's efficacious, and it is will provide great benefit to protect folks from as much as possible from contracting COVID-19, and certainly in the extremely small instances that they might after being vaccinated, that it would minimize any potential severe side effects of contracting it.
Is that good, Tom?
Yeah, I'll defer to my colleagues.
Okay, thank you very much. Thanks for that question. Next is Kate Ryan, WTOP, also with questions for the county executive and the doctors. Kate.
Thank you. Working to find the unmute. All right. So county executive, I talked to you about this yesterday. I still have the question as to why the expenditure of $500,000 for this facility, and Mr. Solomon, if you want to answer as well, when we have NIH, CDC, Fort Detrick working on biodefense and also viruses, et cetera. And is this a firm commitment for this group to stay within Montgomery County? And I have a follow-up question.
Stuart, do you want to start on that?
Yeah, I'm happy to start on that. And great question, thank you. You know, the underlying premise is that this requires cross-sector collaboration. The government can't do this alone. Industry can't do this alone. The research institutions, academia can't do it alone. There are many, many stakeholders that cross a variety of sectors that need to be brought together and work together. And all of the sectors agree with that. And so the government is and will be actively engaged in this initiative. So, you know, I think that cross-sector approach is kind of right at the heart of this and an important element. You know, I think the second thing on the location is that, you know, the task force has already established that the location should be in Greater Washington, and we have established that it should be in Montgomery County as part of that. So the next phase of this project, the current phase that we're in, is actually getting to location specific within Montgomery County. So this is focused on Montgomery County as the physical home for the Pandemic Prevention Center.
Got it. Looking at the documents that were submitted to the county council, there are a couple of things that raise questions. The team that you have seems to be focused on trade, economics, some transportation. I don't see the biomedical community here. Am I missing something? And then as a nonprofit, will the work that you do be open and accessible to citizens and reporters?
So if I start with the latter, yes, and with the former, yes also. I think you're not, you may be looking broadly at the Connected DMV homepage. If you look under initiatives, you'll see the Pandemic Prevention Initiative, and you'll see the steering team that's working on that. You'll see the heavy-duty team of global scientists represented there, but you'll also see business and government, academic and other leaders. Again, this is a cross-sector initiative with pandemic prevention at its very core. So if I can, I would encourage you to look at the pandemic prevention pages within the Connected DMV website.
Thank you. And then the last thing on, I think it was page 3 of the documents, it said potential for additional in-kind support by placing Montgomery County representative on 6-month strategy team. What is that?
Basically, that is an outreach that says, again, we're an open collaborative effort and organization. And we have a core team within Connected DMV, which is a 501c3 nonprofit. And from time to time, we have other parties that help us on volunteer basis for the work that we're all doing together. And so what that is an open offer for someone from the county to work directly side by side with our core team as we do this work.
Was that contingent on the contract?
No, that was an open request.
Got it. Thank you.
Thank you, Kate. Next question comes from Dominique Maria Bonesi from WAMU, and she actually has questions for you, Mr. County Executive. Dominique.
Hi, Mr. County Executive. Thank you so much. I wanted to go to something that was posted on Twitter. I think you took a photo. You mentioned the event on, I believe, Monday,
Right.
the 3rd. And the photo is you in a group of residents, and everyone's wearing a mask but you and one other person. There's comments on the post saying, why isn't he wearing a mask? These are the rules that, the county has put forward as far as masking outdoors. And there's been discussion around, President Biden at the address, more recently, and this might be for Dr. Gales and Dr. Stoddard. That room was full of people who were vaccinated. Why was it necessary that everyone in that room had to be wearing a mask if everyone was vaccinated? I guess the question was, can you give us the benefit of the doubt here? Can you tell us the situation of that story? Because obviously there was a beginning and end to that story.
Yeah, I mean, I was at this event, and I was sitting down and eating, and somebody said, just, can everybody get up and get a photograph? I just got up, and I didn't even think whether or not I had a mask on. But everybody there was vaccinated, and I'm vaccinated, so I wasn't overly worried about it since I was in company of vaccinated people. But I just got up out of my chair when they said, come over here and take a picture. And I didn't think twice about whether I had my mask on still. It was difficult to eat the Chinese food through the mask.
And then just to Dr. Gales, I'm just sort of wondering, looking at sort of the way, we're structuring these restrictions now, when is the line there that, leaders need to start, I guess, or depending on what the rules are, I'm just trying to understand, like, depending on what the rules are, how do leaders, once people are vaccinated, are leaders going to be trying to show that, like, yes, you can be vaccinated in a room with people together? Like, are we going to be able to see sort of role modeling of that when right now it seems like a lot of stuff is obviously virtual and we're at home, but I mean, are we going to be seeing more, I guess, showing that the vaccines work and they're effective and that we can be together in the same room and all vaccinated?
Thank you, Dominic, for the question. I hope that answered your question. I think your question introduces two pieces. The first piece is that certainly as we move forward and more folks get vaccinated, I think you're going to see additional adjustments to restrictions in terms of physical distancing requirements as well as face covering requirements, again, as we get more people vaccinated. And you are likely to see, as we continue to move forward and more segments of our society, both from a personal perspective as well as a professional perspective, open up, that yes, you are likely to see more meetings in person where you are likely to see, people sitting at a dais with face coverings on and those types of things. And yes, we do hope that when that happens, that all of those individuals will continue to follow the relevant guidance at that time and be good role models for the general public to follow. And I think the second component, which your question gets to, you didn't directly ask it, but I do want to put it out there, is that a lot of jurisdictions are looking at that question of how do we factor in, one, the percentage of folks vaccinated, which we've addressed with our previous Board of Health resolution, but how do you confirm that people have been vaccinated? There's been a lot of discussion and different models thrown out. There's different electronic platforms that are becoming available, as well as the conversation, are vaccine cards adequate in terms of proving one's status? So we, like everybody else, is awaiting further guidance from the federal level as well as the state level to determine how we move forward with that, so that, as Dr. Stoddard mentioned, earlier related to those provisions when the CDC says when it's safe to wear a face covering and when it's not advised, that we're able to provide guidance to our residents in terms of how to move forward, again, whether it's in a personal setting or professional business type setting.
And I'll just add to that. I think a key point is, if you look at the CDC's masking guidance, if you break out outdoor, there's some people without, there's some graphics of people without masks on. In those environments, it's entirely appropriate not to wear a mask. But all the indoor environments still have people wearing a face covering, with the exception of when you're eating or drinking something. And so we are going to follow that guidance. And I think that's been our clear message. And so when you start to see faces that are uncovered in those guidance, and I'm very confident those graphics will evolve as the vaccination rate evolves, you will also see, I'll speak for myself, you will certainly see me following the CDC guidelines for indoor masking. I am vaccinated, and I'm going to follow and abide by what the CDC says is reasonable and safe based on the current vaccination rates of everyone across the board. And so to I guess get to the heart of your question, you will absolutely see leaders in Montgomery County reflecting the values that we're holding everyone else accountable to. And that does mean that when it is safe to not wear face coverings, we're going to set an example for when that is safe as well. And so, obviously we will, I'm not going to say, you're not going to see me saying, it's safe for someone else to dine indoors at this point without a face covering. And I'm not going to do that. But I think that we're going to follow the guidelines that we think the CDC has said is safe. And we'll do those things that we think are, what they've recommended. And I think that we're just going to try and model good behavior in following those guidelines when it says, both now when it says to wear the face coverings and later on when it says that it's safe not to.
Thank you.
Thank you, Dominique. Next questions are coming from Rebecca Tan, Washington Post, and they are for the county executive. Rebecca?
Thank you so much. County Executive, you said it's Older American Month, and you noted that isolation has really has had a really bad toll on a lot of older Americans. Are you able to say why the county has kept senior centers, libraries, and recreation centers closed so far? These are places that seniors, as well as a lot of other county residents, have turned to in the past for their socialization.
I mean, there are different issues with different of those things you've mentioned. One is, we don't have everybody vaccinated, and unless you're going to start using passports to determine who comes in, we'd like to be at a higher level of vaccination before we generally open things up, which is why we've set our targets based on the percentage of people vaccinated now. With libraries, we have, and true with rec as well, we have not filled vacant positions over the last year. And we haven't filled them because we did not have places to put people. So as we determined that we're going to begin to reopen things, and now we have to begin the hiring process. And so I don't have enough staff right now to open up all the libraries. And we still have people who are out because of being vulnerable or living with somebody who's vulnerable. So bringing the staff back is going to take a little bit of time, but now we know, at least I think we know what the time frame we're working with, and we'll begin the process of restaffing ourselves. And senior centers still carry the same issue of making sure that everybody is vaccinated and that we don't wind up creating more problems. The senior population has been the most vulnerable population to COVID. I think they comprise almost half the deaths from COVID in the county. Mm-hmm. So we've tried to maintain an abundance of caution, but we also know we are preparing to begin the reopening of libraries and centers, and this will happen.
Mm-hmm. And on the senior centers, just to follow up a little bit, earlier this week, officials said that 85% of people above the 65 have been vaccinated. It seems like this population is pretty well vaccinated. So I just want to follow up on this particular issue again. Why isn't it safe to open senior centers if 85% of those of us over 65 have been vaccinated?
We are having that discussion, and we will be moving forward on more reopenings. They will come.
I would also, just in support of what the county executive said, So we're extricating recreational staff from testing and contact tracing. The last day for them to be doing some of those activities, testing and vaccination, apologies, not contact tracing, is actually Friday, so the 8th. That's the last day where they're all going to be pulled back from there. And I would also state that there are 2 rec centers that are still supporting the distancing of our homeless population, and also 1 or 2 that are still serving as vaccine sites themselves. And so, as the county executive alluded to, working on getting others open and operating, but I do, it's going to take some time to relieve both staff and facilities of the requirements. So of the other requirements necessary. We don't want to have our pandemic response lessened while simultaneously opening our senior centers. We want to be able to do both.
Got it. And I'm guessing that you don't have a specific date in mind. You mentioned earlier you're not a fan of specific dates for health precautions.
I hate dates. I mean, this will be a discussion with the health department and with the departments themselves about what their staffing issues are. But this is, I can tell you that the reopening of things in the county is a priority for people now, because we do see ourselves getting to the point where this is not going to be the issue that it was before.
Got it. And a quick separate question on vaccines. Can, Dr. Stoddard or someone else tell me the protocol for what happens if the county government doesn't administer all of the doses that it receives from the state government? Does it return those doses to the state? And is the county government at danger of doing that, anytime soon?
Well, hi, Rebecca. Thank you for your question. I can speak for the doses that we receive as the health department. So if we receive doses that are not used within that week per se, we don't send them back. We just use them, and our next week, we continue to work to get them out of the door. And with the exception of a handful of weeks, each week so far throughout the vaccine distribution process, we have used up our total allotment and allocation of doses before we've received the next allotment of doses for the following week. And so that's how that's done. And I would imagine the same process is for any doses that are shipped to us for the mass vac site as well. We don't ship them back. We just continue to keep them in circulation and pumping them out the door.
Thank you.
Thank you, Rebecca. The next question comes from Deirdre Byrne for my MCM. And the question is directed to you, Mr. Solomon.
Hi, thank you for taking my question. I wanted to know a little bit more about the pandemic center and the site selection process. I was wondering if there was a some sort of timetable on the site selection process and what kind of work that will entail.
Yeah, so the timeline, we intend to have that completed by the end of August. And right now what's happening is the requirements for, the initial requirements for the site are being developed by the team. And so with the requirements, then we can take that to the appropriate siting work, the location work, to find the specific location that's best suited. And so that's a process here in these next few months that's in front of us.
My next question, and we might be getting ahead of ourselves with this question, but is there a timeline for when we are aiming for the pandemic center to officially launch or open?
Yeah, so the intent of the team right now, and again, there are a number of factors in this, but the intent from the team is to be able to formally launch the new organization for the Pandemic Prevention and Biodefense Center at the end of the summer, at the end of August. So that's the aggressive timeline that the team's working on. Obviously, it will take some time to fill out the center, the staff, and all the functions as we go, but the formal launch is expected and planned for the end of August.
Thank you.
Thank you so very much, Deirdre. Next question comes from Caitlin Peets at Bethesda Beat, and they're directed to you, Mr. County Executive. Caitlin.
Hi, good afternoon. I have a question, once again, unrelated to the pandemic, but Marc, the county recently cut over to a new emergency communication system after several reported outages and problems, particularly and notably a major outage over Mother's Day weekend in 2019. How important is this new system to the county's first responders? What does it provide? And what did you, as the leader of this county, learn from the experience, particularly after several delays in launching this new system that left the old one in such a vulnerable position?
So this system was supposed to have been replaced years ago, years and years ago. And it was identified as being vulnerable. And when I came in, one of the first briefings I got was a briefing that was basically like, the thing is falling apart. It's going to continue to break. We're at risk of major outages. It should have been a long time ago. When we need parts for the system, we're going to the junk bins at other counties that had the same system that we had in place in the past and trying to find used parts out of those junk bins. That's what I walked into. And so our lesson is, the first thing I did is I said, I want you all to buy, wherever you have to buy it, spare parts, so that when some part of the system goes down, you're not spending 2 weeks trying to find a spare part. There are a bunch of things you couldn't buy a new part for in that system today. And so we were literally junk shopping from other people. That's no way to have your mass communication for a public safety system running. So it should have been fixed a long time ago. It was a big ticket item when they finally got around to it. It was way late in the process. And I was, given this kind of scenario of things are going to fail. That's what it was. So, think one thing is when you have difficult decisions to make in their life and safety, you probably ought to make it based on life and safety, and trust that the residents of the county will understand why you're making an investment in something like this, rather than worrying about whether people are going to say you're spending too much money. I don't believe anybody would have said you're spending too much money on radio towers that dispatch police and fire departments. That's one lesson out of this, at least. I think, making sure you've got robust systems, that you identify weaknesses in the system, and particularly where the parts are likely to fail, that you identify replacements before things fail, and either stockpile what you think you might need, or at least know where you can get it tomorrow, so that you're in a better position to respond. I'm really glad this thing, got done, and that we did not have another catastrophic failure. But, I would say that it was one of the most nerve-wracking things as we went through the year, waiting for that moment to come when someone said, system's down again, and it'll be a couple of days before we can get a part in here. So it ended well. It should have been done a long time ago.
So I guess kind of building off of what you've said then, who do you think is responsible for letting the system get to the position that it was in?
I don't think people advocated for it properly. I mean, it's the only way. I was on the council. No one ever walked across the street, whether, from any place, and said, this is a project that has to be done. And I sat there for 12 years, and I was the chair of the Public Safety Committee. And no one said, this project has to be done, and it has to be done now. No one ever walked over and said, if you delay this another year, there's a high likelihood of failure. And when I walked in, it was like, this thing's going to fail. So I believe they knew that was, and they'll tell you, this was known for a while. This is not a project that suddenly came online in 2019 or 2018. The genesis of this project goes back a very long time.
Thanks.
Thank you, Caitlin. And we have one last follow-up question from Kate Ryan at WTOP regarding vaccinations, and either Dr. Gales or Dr. Stoddard. Kate?
Right, thank you very much. I had a question yesterday when you were doing the briefing, and you mentioned it today again. People in their 20s and 30s, that donut in the population that's not getting vaccinated. Do we have a sense of what may be holding them back? And I'm wondering if, given the demographics, is this an age group that often has jobs that don't allow for them to take time off work, for example? Or are logistics and transportation an issue? Do you have any sense of what's holding them back there? And then quickly on dates again for the county executive, I know you hate them, but President Biden has said by July 4th, he'd like to see everyone vaccinated. You know, do you have a sense of whether that's possible?
So does the president mean everyone as in everyone, or is this the theoretical everyone? I mean, theoretically, I guess there's enough vaccine supply by July 4th. You could conceivably achieve this. If you look at the vaccination rates in some states, it would take a major miracle for them to get on track to be able to achieve it. I think that, I think we will get a very high percentage of the population vaccinated by July 1. Of those eligible, which are likely to be 12 and above, I'm pretty confident that by July, we can get there. But that gives me May and June. Yeah, it gives me 8 weeks to get reasonably close. But I don't think it's going to be everyone that fast unless people decide to take the vaccine quicker than we are. This is why, we spent some time talking today about the declining rates of vaccination in the county, because the longer people wait out there, the longer it's going to take us to get to the point when it's really safe to do all this. We talk about herd immunity, but nobody has a number for herd immunity. There's no scientific number in terms of COVID where you know that if you achieve X percentage, effectively, you've achieved herd immunity. So I guess our goal is to vaccinate everybody who will step forward and let us put the needle in their arm. We will do that. And hopefully enough people will step forward that we get to the percentages that minimize this. But again, I think people, throwing out dates, unless you've got a plan to force people to do this, which of course no one is going to do, I think it'll be challenging. And I would rather celebrate reaching milestones toward an end rather than declaring the end is going to be on a set date. That'd be my personal preference.
Gotcha. And then Dr. Stoddard or Dr. Gales, again, on that age group that you said is kind of slower to come in. Do you have a sense of what it is?
Thank you, Kate, for your question. I'll take a stab at it. And just to add to what the county executive mentioned in terms of time frames, we would love to be able to say by date X, we want everybody vaccinated. I think his frustration stems more from being able to move things forward and give expectations. And so, continuing to let the data guide us as opposed to picking an arbitrary time point in terms of how we would move forward. Because I don't think any of us would deny that we would like to be at those points where higher percentages of folks vaccinated by those given dates. But to the specific question, I think the phenomenon that we see happening in this younger age group is in large part, I think, influenced by the fact that even though we have seen cases, more severe cases of COVID pop up in the younger group, I still think part of it is this sense of, well, if I get it, it won't be that bad. Because when you look over the course of the pandemic, I think for a lot of young people, when they see COVID-related fatalities or worsening COVID-related morbidity, they associate that automatically with people who are in the older categories. And unfortunately, that is not the case, because we have seen younger folks have complicated illness and unfortunately pass away as well. So I think it's a sense of, one, I'm young, I'm healthy, I'm invincible, and this is something that kills or affects older people more significantly than me. And so I think that plays a factor into the willingness and readiness to get the vaccine compared to the sense of urgency that we saw a little bit more in our older populations early on in the vaccine distribution process.
Gotcha. Dr. Stoddard, you see that as well?
Yeah, and I think that to address that, we talked about this before, we're trying to make it more and more convenient by increasing the hours, locations, closer to people's homes, because what we're seeing right now is not entirely, everyone wants to say hesitancy. This is not entirely hesitancy. This is, as Dr. Gales alluded to, the loss of the sense of urgency that among this population may have been felt by the older populations who were obviously much more likely to get more severe illness and die from COVID. The virus provided the incentive for them to get vaccinated in a way that we didn't have to. But really with this population where they feel a little more, invincible, convincing them that, because I think really what we're looking at is, if you look at Israel, they've released some really interesting studies where that you can't vaccinate children in Israel, or they haven't vaccinated children in Israel because of the vaccine requirements, but they've seen a precipitous drop in their infection rate among children as they've gotten higher vaccination rates amongst adults. And so what we have to convince young adults of is that they're helping their neighbors. They're helping children, they're helping the older adults as well. They're helping their community, the county, the state. If they get vaccinated, they're protecting others, not just themselves. And so I think increasing it from looking at it from a sort of perspective of self to looking at it from the perspective of community is really what we need to convince young people that there is a benefit to them for societal gain, for being people want to go to concerts and other large opportunities. Well, the vaccine is our key to do those things. I know I said concert. I know the county executive got very excited. He's a big fan. So I saw the look. So everyone wants to do all those things. The vaccine is our pathway to getting there. And so we need to convince people, like, hey, you want to go back to doing these things that we all love and want to do? Let's get vaccinated.
Thank you.
And I want to make clear that I've already bought tickets for concerts going out as far as November and December. So I am counting on everybody getting vaccinated so I can actually go to these things again. I miss this as much as everybody else does.
Thank you, Mr. County Executives. Thank you, Kate. Thank you, reporters, for joining us once again today. Thank you to the usual panelists and the guests today. And with that, we're going to close it. Thank you once again for joining us. Stay safe. We'll see you next time. Have a great afternoon.